Again, what's the heart made of? The heart is made of a bunch of cells. And we've talked about this before, you know, divided off into 4 chambers with 2 valves. So you've got a 4-chambered organ that's made up of cells, and each cell has blood and lymph flowing around it, and then you have a nervous system. This is true everywhere in your body there is. I am a 59-year-old male who has had 2 heart attacks within the last 8 years. Ouch. He has 2 stents. High blood pressure has been a problem for years, so you know right there, kidneys and adrenals, right there. Well, why the heart attack? Well, take a look at this. What does the kidneys and adrenals control? What's one thing? Especially the kidneys. The drainage and the filtration of the lymph system. So when you're not filtering the lymph system, what's happening to it? It's backing up, isn't it? And backing up of the lymph system is backing up of cellular acids. Backing up cellular acids creates what? Inflammation and an immune response. What is the main immune response to acids? Cholesterol. Always cholesterol. Or calcifications, which you really don't want that one, because then you get stenosis or hardening of the arteries and things. That's a lot harder to deal with than it is cholesterol deposits. But cholesterol deposits, remember, not on the vascular wall, in the vascular wall. So this is a lymphatic issue all the way through here. Now, when you have a case like this, guys, you want to first use a cayenne garlic formula. Like I have one cayenne garlic, butcher's brew and stuff, and that'll keep the vascular system dilated, because if he's occluded in the coronaries, he's occluded in the cerebrals and the carotids. So you want to open up and keep that blood flowing aggressively in the body. I would use upper or lower or both circulation formulas to help with that, keeping blood flowing around these people. And at the same time now, you're going after causative problems. You're going after why the occlusions and why the heart attacks. Kidney and adrenals and lymphatics. Clean up the bowels, because the relationship, especially of this descending bowel to the heart. Definitely want to check the parathyroid for vascular collapsing, because if he's losing calcium and he's not putting it back, he could have vascular collapse. Don't forget that one. You have vascular spasms too, which can occur when you have too much calcium loss. So you have vascular spasm, you have vascular collapse, you have vascular occlusions, meaning vascular blockages. And all these, you want it to save your client, to help him get well again. You're going to open up, keep his blood flowing well. At the same time, you're going to get those kidneys filtering that lymph, so the cholesterol and all the calcifications can be dissolved and put back into the connective tissue, and you're going to be cleaning that cholesterol out. But can a leaky heart valve be repaired without surgery using the herbs diet protocol? Even though the doctor says that it needs surgery, can it strengthen or be corrected? We are filled for the surgery and stage of the game. Love, Paul. Hey, Paul. Well, you know what? Definitely. And you want to get in. I would use the heart formula. I would either go to the parathyroid glandular and take that with an addition of kelp. And spend, about 2 months on those 2 formulas. And take kelp on and off as a basic daily hit for calcium and iodine. At the same time, that's the parathyroid. That'll strengthen mitral valves, tricuspids, vascular walls, aortas, everything else. But you want to be able to utilize the calcium, and that's the parathyroid gland. Now here's the other side of this, though, is that you've got to get the acidosis out of the body. Now this could be a genetic past, but it's always caused from the same thing. Acidosis always takes calcium out of the body, and therefore you see your valves go, you see your connective tissue go, you see your skeletal system go. So you start to see a lot of things go. And of course, remember, depression comes in when the parathyroid is low. You're losing calcium to acidosis, and you can't put it back. That breeds depression. So, and when you're repairing valves, you're repairing bones, you're repairing connective tissue, you always take that parathyroid for a month or 2 and use the kelp supplement with it. At the same time, you can pump some green drinks if you want to, but I would definitely take that heart formula too. This is anxiety, heart palpitation, chest pains, and healing crisis. This is a history of panic attacks and anxieties, on meds for 3 years, just kind of going through this. Having pains in the upper torso, stabbing pain, somewhere in the heart center, heart palpitation, nightmares, thin bits of undigested food in the stools, anxiety and panic attacks. Sounds like your problem's right in the stomach area. Remember, that's where the nerve ganglia is tied with the autonomic. That's controlled by the adrenals. So there's no question you want to bring up your adrenal glands and get your kidneys to filter. That's an obvious. But I'll tell you in what you're saying here, you're reaching all to the heart center, the shoulder. You're reaching here from the stomach with the bits of undigested food suggesting of pancreatitis. Hi, Dr. Morse. My husband, who has in the past been very physically active, various sports, is now experiencing dizziness, lightheadedness, ringing in the ears, sometimes sickness and heart palpitations, and performing weight-bearing exercises. What do you think this might be? I think this might be the cerebellum. And I think this, we've talked a lot about this, people that exercise a lot who have kidney weakness and can't filter out the lactic acid and all the other acids that they're increasing by increasing activity of cells. And this can actually escalate instead of do better. This idea that when you exercise, you're cleaning your body and you're really doing good is a fallacy. You've got to be able to filter through the kidneys what you're creating. If you're not filtering and you're creating it, you're going to hurt. Sounds like what's happening to him. So he really has to go after his lymph system. If he doesn't have his tonsils, this is more, these things accelerate even more. But that's going to be the cerebellum back here in the head. He probably has stiff necks and tight shoulders. That's the lymph system, and he really has to get his lymph system moving and drain his head out of here, because these sort of things, when it's up in here, doesn't lead to anything good. Artificial heart valve, blood thinners, and interstitial cystitis. Well, now you guys are really familiar with interstitial. Interstitial simply means around the cells. Itis means acidosis, or their word inflammation. Oh, let's see, what causes inflammation? Is inflammation the problem? No, that's the immune response. No, it's acidosis that's the problem. And so this is why the artificial valves and everything else is what acids are doing to you, my friends. So detoxify yourself. Get your butt in gear, get the kidneys, fix why you had to have valves replaced in the first place. You might also perk up the parathyroid gland in your case and strengthen up connective tissue. Might be helpful in that way. Let's see, why is a lot of people with heart issues have a large stomach and skinny legs? I don't know about that. I don't know that that's true. I've never seen that particularly. I spent a lot of years in cardiac work, and I didn't notice that. When we start to see arrhythmias, whether it's heart blocks or premature beats, some of these things, of course, are electrical. And there's two things that impact the electrical system of the body, parathyroid and adrenal glands. Calcium utilization problems and adrenal neurotransmitters are the two most common. On the way to the heart, in the heart, the lymph system can suppress neural transmissions. Obviously, you see that when your back gets stiff and tight, and then you get numbness in your hands. That's lymph pressure, edema. All of this can suppress nerve function, and hopefully not, but can suppress blood flow. I felt a pain in my chest that felt like a minor heart attack. I felt weak. I thought it was a pulled muscle in my chest. I spoke to someone who lost weight on your program who said she had the same symptom, and a doc told her it was a type of healing crisis. Well, I'd have to know more about chest and where it is in the chest and that sort of thing. When you're pulling on the lungs in detox, you can have a lot of pain. Stomach can give you pain, and sometimes if you build up gas can mimic heart attacks, and there is silent heart attacks, no question about it. But doubt it in a detox is possible, but doubt it in a detox situation. But again, when you're talking about the movement of lymph, you're talking the movement of toxic chemicals, the movement of neurotoxins, you're talking about the movement of stagnant acids. So any type of reflex is possible. Any type of little spasm is possible to go through, especially when the body moves something, moves the lymph, and that lymph has been in that area pulling calcium and everything else. The area is highly spastic in the first place, or pre-spastic. Yeah, you could have some spasms like that. Your congestive heart failure is not from thyroid. Congestive heart failure is from kidney and adrenals. Big time. When you see congestive heart failure, you see kidney failure simultaneously. My name is Ozzy. I am a 35-year-old male, and my question is for my dad, who is 56. He has a leaky heart valve and had a bout of shingles. Whoa. Okay, so A leaky heart valve, I would be checking that parathyroid of his, check his fingernails, look for those things that are connective tissue or involved in calcium-related issues, because that's what you might have to want to do with him, is deal with that. Now let's go to strengthen the mitral valve or tricuspid. Doesn't matter, you want to strengthen, but to strengthen you want to remove the acids that are taking the calcium out of these tissues. So in the heart, around valves, around anything, acids build up everywhere. Everywhere there's cells, which is where? Everywhere you're going to see that lymph fluid, and you're going to see cell waste, and you're going to see acidosis if you're not filtering these wastes out. It's that simple, and when you understand that, you can fix everything up. Let's see, my friend wanted me to ask about MVP, mitral valve prolapse. Her name is Samantha, and I will be showing her this video. She has MVP and would like some suggestions as what she can do to heal it. The heart has two valves that open up and allow blood to flow from one chamber to another chamber. You have the two top atrials and the two bottom ventricles. So these valves, the tricuspid and mitral valve, are the valves between these chambers that when the electrical pulse comes, opens a valve, then your blood flows from one to the next and shoved right out into the system there. First to the lungs to get oxygenated, and then out to the body to feed the cells. Whenever you see a weakness in connective tissue, valves, sphincters, which close, open, and close like the stomach, the bladder, when you see these weaknesses, the suggestion might be parathyroid. Now, it's possible that someone down in the family had so much congestion in the heart, congestive heart failure, blah, 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 that high acidosis, of course, weakened the valves. And then genetically passing that weakness, yes, that is true, and you might not have a parathyroid weakness. But out of the sake of all this, you've got to move lymph. Prime, broken record, whatever, you got to move lymph. That's the acid medium that continues to perpetuate these weaknesses. Second of all, I would pop up my parathyroid just to get calcium utilization. Then all your nails, your connective tissue, your sphincters, your valve, everybody gets stronger. So the key is the acid side of chemistry and the lymph system. That's where the problems come in when you're starting to see the breakdown of tissue, whether it's valves, like I said, sphincters, just muscle, bone, doesn't matter. Simultaneously, really move your lymph, clean up the bowels. Always follow that protocol, and you'll do well. Tell your friend there that she's got to move lymph, and that'll correct anything that could be of a local area of acidosis that's removing acids, because that can also lead to cholesterol plaquing in the artery wall, stenosis in the artery wall, all leading to occlusions and then heart attacks. If it's just a genetic weakness in the valve, you can still strengthen it up, but you want to make sure you're moving lymph, empower the cells, empower the body, and make sure that parathyroid is up there, and you'll be okay. Yes, you can fix a heart murmur. That's another thing, isn't it? Dealing with heart murmurs and mitral valve prolapses, go to the parathyroid and strengthen the parathyroid. Get your body utilizing calcium and get that lymph moving so you don't lose calcium. And heart disease is a stupid name. I mean, you got blood occlusions, which is generally a lipid occlusion or a calcium occlusion. That all comes from acids. It all comes from the lymph system. You have congestive heart failure. It's not a disease. It's a lymph system backed up in the heart. You have the calcium loss, so then you have mitral valve or tricuspid valve loss, so you have regurgitation. You have electrical system in the heart that the adrenals control, so that can go off, and you can have all kinds of symptoms, from AFib all the way to throwing PVCs, heart blocks, blah, 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 blah. You just go in and make the body healthy there. The relationship is not with testosterone. The relationship is with the kidneys and the lymph system, and I might add the adrenals. So the connection to heart disease and testosterone isn't through the testosterone pathway, it's through the adrenal, kidney, and lymph pathway that low testosterone means. But they're fixated on this and not looking at causative factors. Where does testosterone come from? What's the role of the adrenals and kidneys? But they don't even know that yet. Understand that in congestive heart failure and in most failures, whether it's a nervous system affecting the depolarization of the heart, whether it's the blood flow to the heart cells, whether it's the the lymph system of the heart, like I said, CHF, congestive heart failure, this still all has its basis in the lymph system. You'll be amazed how simple the human body is when you look at it simplistically, and how when you work on that one system, everything cures itself. I find it very simple. This is one question asking me about if I'm addressing heart disease. Many doctors say that a low-fat, plant-based diet, heart disease is non-existent and in fact reverses. Yeah, that's just what you're doing here. You know how if we have cardiovascular problems, we just go out and exercise. We just go out and do cardiovascular exercises. That'll strengthen our heart. Oh, really? Will it? Well, it strengthen your heart if you're not filtering the acids out of that heart tissue you're creating. Because when you're creating more activity of the heart, you're creating more acids from the cells, just like you would anywhere else, because the heart's made of what? A bunch of cells and two major fluids. So really, fruits, berries, and melons, high in flavonoids, which strengthen the integrity of the vascular system. So in all heart issues, fruits, berries, and melons are still going to come up there being the highest foods possible. You're always going to move lymph, you're always going to fix the kidneys, and you're always going to work on the adrenal glands, which translates into the autonomic nerve health. And that's nerve health here. Now, the thyroid does affect heart rate. So you're definitely going to work on the thyroid and the health of the thyroid, but when you go and look and say thyroid, you also have the parathyroids, and calcium is a vital constituent to nerve health. So, and not only connective tissue, but bone. People have mitral valve prolapses or heart murmurs, have weak valves. This is calcium utilization problems, the same with connective tissue. So if you look at this, the simplicity of this is you're going after all the cells of the human body and making them healthy. Because if you wander too far from that, you're separating from that and going like medical doctors to individual symptoms, and you're getting confused because now it takes you away from the whole. You must incorporate the whole when you look at the part. You always have to do that. And when you do that, you're always successful because you always have to detoxify. That's why it's the golden key. Remember, the end result of detoxification is regeneration of tissue.